Our policy is that we're the hospitality game. Our job is there for the client and the customer. So whatever their needs are, or wills and wishes and wants are, we try to cater to their needs. We'll do halal meals, we'll do kosher meals, gluten-free meals, as I've said. Any dietary needs, people that have any problems whatsoever in their eating disorders, we'll cater to their needs. We've got people at the base hospital. We've got people at St John of God Hospital that we supply sandwiches and salads and meals to. We also do meals for Bendigo Golden Oaks Nursing Home, Gestalten House, St Stella Anderson, Joan Pinder Nursing Home, Simpkin House, Alexander Bain Centre, Rehab North, Rehab East at Ann Cordell campus. So quite a number. Our menu is a 28-day cyclic menu. So basically there's a component for a choice for breakfast, porridge, bacon, eggs, scrambled eggs, things like that, and cereals and fruit, through to lunch, which consists of 2 main meal components and a vegetarian component, which can be swapped and changed and throughout the course of the day. And then there's 15 sort of menu items on a short order list that if they don't like anything that's on any given day, they can sort of go and say, look, I can have some steamed fish, can I have a piece of chicken or whatever else the case may be. All our raw materials come from Castlemaine and Bendigo. Our greengrocers source them from basically as many local suppliers as they possibly can. We don't specifically ask for that, it's just that that's their policies and procedures that they do. And they're all HACCP certified as well, which complies with our food safety standards. Hazard analysis and critical control point. And basically it's a procedural step-by-step process from the start to the end product. So we can identify where the product started, where it finished, if there was ever a problem. So we started identifying, well, we're double handling here by making the same dish or the same types of things to remove the gluten. So we went, hang on, how do we go about making it a one-step process for all? Having done that, we looked into it and we went, well, okay, well, let's modify our recipes and our menus and things like that to try and make them more user-friendly across the board. If we can make all our food 100% gluten-free, well, it covers it saves a lot of problems. It reduces the risks of sicknesses or allergens happening across the board, and it simplifies the process. So you're not doing double handling, costs are reduced, the patients win across the board because there is no real difference in flavour. If you're using fresh and raw ingredients, is what we do here, you'll extract those flavours from those raw ingredients, and that's the key. One of the greatest things that we're doing at the moment is putting in a new computer software, which is fully integrated, so that it doesn't matter where you work in Bendigo Health, if you have access to a computer, you'll be able to access our software. If you would like to hold a small meeting with some people, you'll be able to order food online. For nursing staff, for example, if they have a patient there that has an allergen, they'll be able to access that patient's data, put that information, we'll be able to link menus and recipes to that person's individual allergen need. So it's an absolute fantastic tool for the clients, and more for the clients, because it'll help identify any issues that they may have. But across the board, we'll be able to order food online, we'll be able to, recipes and menus will be manufactured online using the software and the data that's available. So it'll cut down wastage, it'll cut down costs, it'll help for stock take purposes. Across the board, it'll be a fantastic system. The Burr Lodge food trolley, that's the trolley that we're talking about. We implemented that about 3.5 years ago. We started implementing that. We identified that the food trolleys in the old system wasn't working. It wasn't food safety. It wasn't meeting Australian standards. It wasn't meeting the Victorian Food Safety Act of 1984. The temperatures were inconsistent. They were fluctuated. So by the time the patient got the meal, it was cold, or it wasn't at the correct food safety temperature, which is 75 degrees. So we replaced them with the Burr Lodge food delivery system. Now that Burr Lodge food delivery system has two compartments on it. It has a heating compartment and a cooling compartment. So basically what that means is the staff at the base hospital, for example, they will plate the meals for the base hospital, which is 120 odd meals, and they will go through it through a production line, belt line. They'll plate up the meals for the individual's needs because they have a menu card, no different to a menu receipt from a hotel or a restaurant, and that'll identify what that client needs. The staff will then put that onto the trolleys, one for the hot side and one for the cool side, so the cool drinks and the sweets and whatnot. They're then put into the Burr Lodge trolley. The Burr Lodge trolley is then turned on, which takes about 1 hour and 20 minutes. The food reaches a core temperature of approximately 82 degrees. It's then distributed to the various wards and to the various clients, and away we go. We look at their customers and we give them the best possible service with as much range and diversity as we possibly can. We all walk around with our heads held high because we do deliver a good service and we do deliver a great product at the end of the day. And that's why we do what we do. And that's why we try and implement constant change. We often listen to new ideas and menu ideas and recipe ideas, and we take on board any constructive or any criticism that may be given to us.